of the skillful endovascular surgeons from Henan Provincial People's Hospital, and I know him more than 2 years. I admire very much his skills, and he's doing a lot of cases, and now he will present a case of very complex dural ateriovenous fistula. I think that was done recently. So please go ahead, Dr. Herr.
Yes, thanks for the introduction.
Welcome.
Actually, I am Dr. He, yeah, in Chinese. The passenger can call me Dr. He, yeah, in English.
他今天的讲课是硬脑膜动静脉瘘的一个介入治疗，贺迎坤医生。
Yeah, this is a complex dural ateriovenous fistula, and was done a few weeks ago. This is a brief introduction. He's a 17 years old boy. This boy, a year and a half ago, he was admitted for left atrial osmosis with conjunctive congestion for more than 2 months and was diagnosed as DAVF. Last year, he underwent DAVF embolization, and the post-operative symptom of the left leg was significantly improved. But in recent 20 days, he got poor appetite, significantly reduced food intake, accompanied by obvious symptoms such as headache, nausea, and vomiting. The luminal puncture pressure matched as was 300 millimeter. So the PE was left extrafemoral with conjunctive congestion. This was last year's angiography of the DSA, showed that the fistula was faded by the PCA and the ICA branch. Also the right ECA. Another is the left vertebral base artery. Here we gave him the first treatment on the last year. The embolization was protected by a 8 to 40 millimeter balloon. We want to use the balloon to protect the venous, but we can see that the balloon was too small to protect, to occlude the the sinus, yeah. So at last the onyx filled in the sigmoid sinus, and we can't so we can't remove the blood stream. This is the last angiography of the right ICA. So the sigmoid sinus was not protensive. So this year, this patient was admitted again for the symptom aggravation. And this time, the most failing artery was the cervical trunk, and meningeal hypocele artery, and the branch of the ICA both sides. So also the posterior meningeal artery. So another most feeding artery was the ceroclavicle trunk of the to the trochlear sinus. So this is the MRI. We can see many flow voids. So after consultation, we developed a treatment plan for the occluded trochlear area sinus and the straight sinus and superior sagittal sinus. So it's a big decision. As this is a brief introduction of the operation procedure. In total, we used 18 onyx. 18 onyx was used to intraoperatively to block the trochlear hyperhale, straight sinus, and the superior sagittal sinus. And most of them were finally embolized, with only a small part of the superior sagittal sinus and the straight sinus blood supply remaining. So this is a cast of the onyx. We use the many onyx embolization, and this is the final angiography. So you can there are still some flood from the MHA to straight sinus, and some to the superficial anterior sinus. Because we can the onyx cannot navigation to this area, so we decide to finish the procedures. This is the immediate post-operation CT, no obvious, and this is MRI 7 days post-operation. This is another imaging. So post-operation, the patient was conscious, slightly drowsy, and vomited frequently. That was improved significantly after drug treatment. Conjunctive sensation of the left eye was significantly improved, and the osmosis was steadily improved. So as this procedure, we have some thinkings. First is that for the sinus, it is the first protection. We should to protect the sinus, so the flow can if the sinus was closed, second is if the sinus was closed, we should to try to recognize the sinus. And this at last, if we can't protect the sinus, we have to close the sinus to treat the DAVF. But this will be very difficult to application the draining vein. So as we have to protection and recognition of the occluded sinus, we prefer to use the balloon, but we can see that there are most of the time we can't find the suitable balloon, suitable size balloon to protect the sinus. Or the balloon on the market is always too small. So sometimes some professor use standing balloon and with standing to protect the sinus. Yeah, this is our opinion. Thanks for your attention. Okay.
Okay, thank you.
Professor?
Okay, thank you very much, Doctor. Let me get you off the screen share here. Okay. Okay. The floor is open for any comments or questions of Dr. He.
So for me, it seems that you have to occlude at the same time the sinus and then at the same time to have it open. So it is a little bit controversial. And my second question is, how much are the costs? How much is the price for one onyx? You were telling it is expensive. You used 18 onyx. How much is the price? I'm interested.
Yeah, about 5,000 yuan RMB each one
5,000.
onyx.
Mhm.
Yeah.
Okay.
So, but the idea would be that you occlude the sagittal sinus and then at the same time you leave it open with some stent, or did I understand right?
Yeah.
You should leave a stent inside the sagittal sinus. Yeah. Okay, I think people who understand better, Luis Lopez Ibar, would you like to comment? Luis, can you hear me?
Yes, yes. Good afternoon, Joha. Congratulations, Dr. He. It's a very difficult case. I have some comments. The problematic is, first, is the evolution when you occluded the lateral sinus or the longitudinal sinus. You are the problem of the venous drainage, chronic venous drainage of the brain, and some patients come to dementia. Be careful from this. The second point is when you need to occlude the totally of the dural fistula. It's okay to put to take a balloon or to place a stent wherever you want. The most important is close the origin of the fistula. And in this patient, I think is in the junction in the lateral sinus and not in the torcula. I think it's distal. And one possibility most easy is direct punction of fistula with transosseous approach. It's possible this with transosseous approach with the emissary vein, you are a small foramen, you check this point and you are more close to the high flow part of the fistula. And you protect at the same time with a balloon the junction of the longitudinal sinus with the lateral sinus. Is danger to evolution to the patient. At the beginning, with the clinical symptom, is only pseudotumor cerebri, hypertension, hyperpressure in the brain, but don't bleeding, don't have dementia, don't have too much fist symptom. Only the exophthalmos with collateral circulation. I think it's a complex case, of course, and particular case. In my experience, I have more than 6 or 7 cases, similar case, and never I occluded the longitudinal sinus of the bilateral sinus. Sometimes one lateral sinus, no both. Is my comment.
Thank you.
Okay. Okay, thank you very much, doctor. We hope that you do more presentations in the future.